If you get pain and discomfort through the front and the inside part of that right hip, then listen up. Now, I just assessed a client about 10 minutes ago, and I've had a few of these recently, who tend to be quite pinchy through the front of that right hip joint and into the upper adductor. Now, what I identified very quickly was that she's limited in her ability to flex the hip and to actually externally rotate it and to actually extend the hip as well. So she was pretty compressed around that right hip in multiple directions, and the left hip was a lot freer. When she would squat and toe touch and do most movements, she'd tend to turn into that right leg, but she struggled to get out of it. And I saw this on her gait videos that she sent me as well. And so it was pretty quick to see that there were the same patterns coming back every single time. So what we worked on is firstly decompressing around that hip. We did some pelvic tilts. We did a specific breathing exercise where we worked on engaging the hamstrings, the adductors, and the oblique muscles, which wrap around here. And then we worked on basically getting in and also out of that right hip, which for her is much more important, with a mobility exercise, a side-lying mobility exercise. And then I got her to use her foot from a bent position, so like a mid-stance position, to push up and out to get some extension and external rotation of that hip joint.